My name's Ellen. I'm one of the Myeloma Information Specialists here at Myeloma UK. So myeloma represents about 1% of all cancers and about 15% of blood cancers. And there are almost 5,000 people diagnosed every year in the UK. That's about 14 a day. So myeloma is a cancer of plasma cells. Plasma cells are found in our bone marrow. Plasma cells produce antibodies that fight infection. In myeloma, the plasma cells multiply out of control and they've gone wrong. They're not normal, healthy, functioning plasma cells. And whilst they still produce that antibody, it's not a useful antibody, it serves no useful purpose. It does affect men slightly more than it affects women, and it is a cancer of older people. Probably the biggest risk factor is the older you get, the more likely you are to develop myeloma. So it's more commonly seen, for instance, in those over 65 or 70. It's very uncommon for it to be diagnosed in those under 40 or 30. Other risk factors might include being exposed to certain toxic chemicals, for instance, such as those that you would find in the petrochemical industry or agricultural pollutants or anything like that. Another risk factor is people who have been exposed to certain viruses, and although we say it's not a directly inherited cancer, there is a slight increased risk of myeloma amongst family members. It's a very small increased risk, but it is there. Myeloma doesn't spread to other organs like some cancers can. For instance, lung cancer and bowel cancer commonly spread to the liver, for instance. But it can affect other areas of the body. The abnormal protein it produces can affect the kidneys. It can affect surrounding bone and cause that bone to be thin and to fracture easily. And it can affect, as we've said, the production of the normal healthy antibodies. And also our bone marrow is where our healthy blood cells are made, our red cells, white cells and platelets. So it can have an effect on the production of those good healthy cells. So often patients are anemic, for instance. Because myeloma is found in the bone marrow and it can affect surrounding bone, one of the most common symptoms is pain, and as I've said, it's usually in the lower back or the rib cage, but patients can experience pain anywhere. Another very common symptom of myeloma is extreme fatigue. Patients are quite commonly anemic at diagnosis, and if you're anemic, then fatigue is probably one of the biggest symptoms. We know that myeloma can affect the kidneys, and if there's any kidney damage caused by the myeloma, patients may notice feeling generally unwell, some nausea, they may notice some urinary symptoms, frothy urine, or passing less urine, for instance, or swollen, puffy ankles and shortness of breath. Puffy ankles and shortness of breath are signs of fluid retention, and that can happen if your kidneys aren't working as well as they should. So myeloma can be quite difficult to diagnose because the symptoms are quite vague, and they may well be symptoms that you would associate as you get older anyway. As you get older, you perhaps expect to be a bit tireder, you expect to have some aches and pains, and because GPs really only come across myeloma perhaps twice in their professional lifetime, if someone comes to their clinic with backache and tiredness, an older person, myeloma isn't the first thing they think of, so it can be quite difficult to diagnose. It is often picked up on routine examination. Sometimes a routine blood test picks up an anemia, for instance, or evidence of an abnormal protein. If a GP suspects that a patient has myeloma, a referral to a haematologist happens. The haematologist will likely want to do further tests just to confirm or rule out the diagnosis. And those tests would include a bone marrow biopsy. So a bone marrow biopsy will measure the percentage of plasma cells. Someone who doesn't have myeloma, for instance, would have less than 5% plasma cells in a bone marrow biopsy. Someone who does have myeloma may have anything from 10% upwards. Other tests would include further blood tests to determine this abnormal protein. Another test that's done is a skeletal survey. That's a series of plain x-rays to look at the bones, all the bones of the body, all the long bones, the chest, the rib cage and the skull, to see if there's any damage to the bones caused by the myeloma. Well, myeloma is probably one of the most complex and individual cancers, and treatment really is very individual. There are different treatment pathways depending on the patient. Treatment for myeloma is usually a combination of three things, usually absolutely a steroid, with or without a chemotherapy drug, and perhaps some of the newer drugs. For younger, fitter patients, they would certainly be offered initial treatment to reduce the bulk of the myeloma, and then high-dose therapy and stem cell transplantation. When you're getting three different types of treatment all at once, it's attacking the myeloma cell in three different ways. So you're really bombarding the myeloma with anti-myeloma treatment. Myeloma is what we call a relapsing and remitting cancer. So it's treated, it's brought under control for a period of time, but at some point it will always come back, and then it's retreated again. So patients can have several periods of remission and relapse.